Hey everyone, welcome back to Miranda Beauty and Wellness channel. Today is June 5, 2024, and we're going to explore the different Botox injection patterns used to address various facial concerns. From forehead lines to lip wrinkles, we'll be covering the most common areas treated with Botox. Let's get started. Forehead lines. The forehead lines are one of the most common areas where Botox is used. This is because the muscles in the forehead are responsible for creating horizontal lines. Look at this in here. Forehead lines. By injecting Botox in these muscles, we can relax these muscles and reduce the appearance of these lines. Here, I'll be marking the areas where Botox injections will be administered. And I'm going to be using this makeup pen. But typically, the injections are placed in a grid pattern with the first injection at the center of the forehead and the others spaced evenly apart. Again, the goal is to relax the muscles that create these lines rather than completely eliminating them, because this can lead to an unnatural appearance and frozen face. And we don't want that. We want it to look natural and still have some movement, although very minimal, so that we can avoid the wrinkles to be formed. To inject the forehead lines, which are the horizontal lines that are forming here, we target the frontalis muscle. The frontalis muscle is very superficial, and that means that we typically inject in a 15 to 30 degree angle and very superficially inject the needle. Versus the procerus and the corrugator muscles, we would inject in a 90 degree in a deeper fashion. In this case, is a little bit more superficial because the frontalis muscle is very superficial and very thin. Now, how would we pick our sites? Some people need more injection sites in the forehead than others. But in my case, I'm going to be doing 5 injection sites. So typically, we start in the middle here, and we want to stay 1 finger breadth above the eyebrow bone. So I want to stay above here and up, okay? Now, what I want to do is I want to go ahead, mark our first point, which would be around here, then here, then here, then here, and then here. And again, you would inject in a very, very superficial pattern, okay? Worry lines, also known as the glabellar lines. These vertical lines that form between the eyebrows are the 11 lines, and they can make us look concerned or even angry. Botox injections in here can help us reduce the appearance of these lines. The glabellar complex, we need at least 5 injection points, but we can do 7 for people that need more Botox in this area, which is the procerus muscle and the corrugator muscles above the eyebrow. The key is to prevent these lines from forming, thus smoothing the muscles out. We want to make sure that we inject the area well and we stay medial to the mid-pupillary line. We get our pupils as a marker, and we do an imaginary line here, and we stay inwards. 1 here, 1 here, and 1 here. The glabellar complex is the frown lines, 11 lines in here. You want to grab it like this, and we would inject it more at a 90 degree angle. The way that we determine how we're gonna inject these muscles is by making a imaginary or makeup line in here, like this, from here to here. And then we do another line from here to here. And then from here to here. And then our injection site would be right here. Now let's talk about crow's feet. The crow's feet are the lines that form at the outer corners of the eyes when we smile or squint. Botox injections here help relax these muscles so that they smooth out. For crow's feet, the injections are usually placed in a diagonal line, starting at the outer corner of the eye and extending down to the cheekbone. and it depends on the person. Some patients have a fanning crow's feet that have all over, up, middle, and down. But some have only lines upward or only lines downward. Depending on their pattern is where you're going to inject. If you're going to inject only 2 or 3, above or below, or all the way. Depends on the person. In my case, my crow's feet are a little like in the middle and upwards. So we would go here and here. Some people need 3 or 4 here. Depends on their pattern. Some people have a fanning effect, like more up, middle, and down. Some people have it upwards only. Some people have it downwards only. It depends on the person's line formation. Now, let's talk about a chin dimple. A chin dimple is an indentation that can make our chin look uneven, and it causes a lot of dimples. See here? So the way that we inject the chin dimples are either in the middle center, Botox injection, or 2 parallel to each other. I typically do just the 1. But if the person has a lot, you should do the 2. You can either do 1 in the middle, or let's see if someone has very severe, we'll do 2. Let's say you have a gummy smile like this. You're showing all your gums. So a gummy smile, you want to treat it in here and here. This is for Botox. For fillers, we avoid this area. Next up, bunny nose. Bunny nose is a small bump or indentation in the nose that can make our face look like a bunny. Look at these lines. That's a bunny nose. Botox injections to relax these muscles are really in the nose itself. Here and here. And then that's where we would inject the Botox so that we can relax these muscles and stop that bunny appearance and wrinkle formation. For bunny lines, one here, one here. Okay. Lip wrinkles. The lip wrinkles are the lines that form around the mouth when we smile or talk. Look at these lines in here. Also, when a person's a smoker, they tend to have a lot of wrinkles around the mouth. For lip wrinkles, the injections are usually placed in a circular pattern around the mouth. And the goal is to relax the muscles that create these lines. Lip wrinkles. Eyebrow lift. An eyebrow lift is a procedure that involves injecting Botox into the muscles that control our eyebrows. And it helps to lift the eyebrows and give a face a more youthful appearance. But for eyebrow lift, the injections are usually placed in a series of small dots along the eyebrow, starting at the outer corner and then moving inwards. The goal is not to do too much, because if we do too much, it can lead to an unnatural appearance. We don't want a frozen face. We want it to still have some movement and look natural. Thus, we don't want to overdo it. We might have to make sure we're just doing what's necessary and not overdoing it. So that is it for now. Remember to hit like and subscribe so you don't miss out on our next episodes. We're going to be keeping talking about Botox, fillers, video threads, all the aesthetic trends. We're going to be talking about Ozempic, Mounjaro, celebrities, and hot topics. And remember, beauty and wellness start from within. Even though we want to look pretty to make sure we look nice and feel nice, we still have to work on our inside appearance as well. And that's why I keep saying that. Beauty and wellness start from within. Keep healthy. Until next time.